Good morning, everyone. Here we go for October the 15th, 2014. Here's the headline. I'll put the link below. Sloppy protocols. Second healthcare worker from Dallas hospital tests positive for Ebola. A second healthcare worker at Texas Health Presbyterian Hospital who provided care for Thomas Eric Duncan has tested positive for Ebola. The Texas Department of State Health Service announced the unidentified healthcare worker reported a fever Tuesday and was isolated at the hospital, authorities said. The preliminary Ebola test was run late Tuesday at the State Public Health Laboratory in Austin, and results were received at about midnight, authorities said. The Centers for Disease Control and Prevention has begun confirmation testing. Health officials interviewed the patient, hoping to track down any contacts or potential exposures in the community, the CDC said in a statement. While this is troubling news for the patient's family, and colleagues, and the greater Dallas community, the CDC and the Texas Department of State Health Services remain confident that wider spread in the community can be prevented with proper public health measures, including ongoing contact tracing, health monitoring among those known to have been in contact with the index patient, and immediate isolations if symptoms develop, the CDC said in a statement. The diagnosis follows days after nurse Nina Pham, 26, who also treated Duncan, was diagnosed with Ebola. You've got to remember, when Thomas Eric Duncan first went into the emergency room vomiting, they did not diagnose him with the Ebola virus. They sent him home with antibiotics. So these healthcare workers were not in any type of hazmat suits or protective gear. So, of course, what do we expect? The diagnosis follows days after Nina Pham, 26, who also treated Duncan, was diagnosed with Ebola. Duncan was diagnosed with Ebola September 30th and died October 8th. CDC Director Thomas Frieden had previously suggested that Pham may not be the only person who became infected while treating Duncan. Well, I guess that's obvious. It is possible that other individuals could have been infected, like the workers that were cleaning up the vomit outside the apartment complex of Thomas Eric Duncan, and they were not wearing any protective gear. And then this is going into where? The sewer systems? Ebola has killed more than 4,000 people, mostly in the West African countries of Liberia, Sierra Leone, and Guinea, according to recent figures by the World Health Organization. And let's go to ABC if we can.
Reporting, George Stephanopoulos.
And good morning. We are coming on the air right now because we have just learned that a second healthcare worker who provided care for the first Ebola patient diagnosed here in the United States has now tested positive for the disease. The worker was among the 76 people who took care of Thomas Eric Duncan after he was diagnosed in the hospital. The second person who has now tested positive reported a fever Tuesday night, was immediately isolated, and the preliminary test for the disease run late last night. More tests are now being run at the Center for Disease Control. The 48 people who came into contact with Duncan before he was hospitalized are so far showing no symptoms of the disease. We're going to have much more on this on GMA coming up at 7 a.m. on the East Coast.
All right, and there you have it. The second now healthcare worker has been diagnosed with the Ebola virus. Stay tuned to my channel. I'm working on a story that's going to break this wide open. Is our government behind this plot to bring down the United States of America? Whatever you do, stay tuned to my channel. Like the video, share, and subscribe to my channel. And I've got a video coming up that just might wake up the sheeple and open a few eyes.